And this week is Food Allergy Awareness Week. So I'm so glad we could be joined by an expert in the field, Dr. Ruchi Gupta from Northwestern University. She's going to talk about food allergies and your family. I recently heard Dr. Gupta speak at a food allergy initiative event, and I was so impressed with her and with that group that it's really great to be able to bring her research and knowledge to all of you. She'll be taking questions a little later, but you can type them in at any time while she's talking, and we'll get to as many of them as we can. And also a reminder, everyone who's here is entered to win a copy of Kiwi's new cookbook, Allergy-Friendly Food for Families, which we're really proud of. It's a really family-friendly collection of safe and delicious recipes. So I hope you all enjoy that, especially those of you who win it. And we'll notify you by early next week if you win it. So now let's move on to Dr. Gupta's talk. And Dr. Gupta, thank you so much for being here. And please, take it away.
All right. Well, thank you so much. It is my pleasure to be here, and I appreciate the kind introduction. I'm going to be talking today about childhood food allergies. And if you are on the webinar, follow along with the slides. And if you're just on the phone, I'll try to describe the slides to you as well as I can. So let's get started. The objectives for today's talk will be to understand the current prevalence and severity of childhood food allergies in the United States, to know the top food allergies and their severity, to discuss future directions in food allergy therapy, to understand how food allergies impact families, and to share tips for living alongside a child with food allergy. I'm going to start with some of our most recent work when we conducted a study, a randomized cross-sectional screening survey of 40,000 U.S. households with children. And we were able, from this study, to get a better understanding of what the prevalence of food allergy is. And in the study, we found that 8% of U.S. children, almost 6 million, have food allergy. Now, this is 1 in 13 children, or approximately 2 per classroom. And those of you with children, especially younger children, have probably seen this in your own lives, in your own classrooms. Food allergy does seem to be increasing in frequency, but it was nice to be able to put a number to it. So 8% is the number that we came up with. And in this study also, we were able to better understand severe reactions. And we found that almost 40% of the kids who had a food allergy had already experienced a severe food allergic reaction. I think this is really important because often there's misconceptions about severity of food allergy amongst the general public. And people tend to think that children will break out in hives or get a little bit of swelling, but it's not life-threatening. And so what we were able to show in this study is that 40% had already experienced a severe reaction, and many are, may not have experienced their first severe reaction, but it is not just a mild disease like alert allergies, like environmental allergies. It is a severe, potentially life-threatening problem. And then the other important thing we discovered from this study was that 30% of these children had multiple food allergies. So they were not only allergic to, say, peanuts, but they were allergic to peanuts, tree nuts, eggs, milk, etc. So it made it a little bit harder on the families with kids with multiple food allergies because they have to avoid that many more foods. Okay, this next slide, we talk about common food allergies among affected children. So in our sample of children with food allergy, we found that 25% of them had a peanut allergy. So 1 in 4 kids with a food allergy had a peanut allergy. 21% had a milk allergy, about 1 in 5. Next was shellfish at 17.2%, then tree nut, egg, then fish, wheat, and soy. Now this next slide shows the prevalence by age. And I think this is really interesting because what we noticed here is as age increases, so we have categories from 0 to 2, 3 to 5, 6 to 10, 11 to 13, and greater than 14 years of age. And what we found is in peanut allergy, for example, it was pretty steady throughout the age group. So for the 0 to 2 year age group, 22% of them had a peanut allergy, and went up to 30% in 3 to 5, 25% in 6 to 10, 28 in 11 to 13, and 20% in greater than 14 years. So what this is showing is that it's pretty steady all throughout age, and it doesn't seem to be going away in the greater than then 14 years of age, there was still 20% peanut allergy. The next is shellfish, and shellfish is really interesting because children are probably not exposed to shellfish early in life, so you see smaller percentages of shellfish allergy at 0 to 2 and 3 to 5. However, it steadily increases until you get over 14 years of age, where 23.8% of those kids had a shellfish allergy. Now, tree nut follows along relatively closely to peanut. Milk and egg were two that were always considered to be high in the younger ages, and kids were outgrowing them as they got older. Now, this is still true for egg from our data, where 15.8% of kids 0 to 2 had an egg allergy. By the time they were over 14 years of age, there was only 4.1% egg allergy. So that's a great sign that kids are still seem to be developing tolerance, outgrowing their egg allergies. However, for milk allergy, it is declining through the years, but in kids over 14 years of age, 18% still continue to have a milk allergy. So unfortunately, it seems like this allergy tends to be holding on a lot longer than previously thought. And wheat is pretty steady through the years. Moving on, this next slide, we talk about food allergy severity. And I just wanted to talk a little bit about, this is how we characterized it in our study, but I also wanted to talk about food allergy symptoms. And so what we considered mild to moderate symptoms, but very common symptoms for children with food allergy include things like angioedema, which is swelling of the lips, eyes, or other parts of the face, other types of angioedema, coughing, any oropharyngeal symptoms. So this could include scratchiness of the throat, tingling of the tongue, eczema, which is the itchiness kids get. Atopic dermatitis is another term for this. Flushing, hives, which is one of the most common symptoms of food allergy, a milder symptom. Itching, pruritus, which is itching, and vomiting. We characterized severe symptoms by any report of anaphylaxis, which is a life-threatening reaction. If a parent said they had anaphylaxis, we took it as anaphylaxis. If they had a drop in blood pressure, trouble breathing, or wheezing. And if they had a combination of things like vomiting, swelling, and coughing. So common symptoms of food allergy. And then what we found is, what I mentioned earlier, is that 39% of children who had a food allergy, 39% of the children with food allergy had had a severe reaction. And this next slide shows the types of foods that were the most severe. So 52% of kids who had a peanut allergy had experienced a severe or life-threatening reaction already. And then followed by tree nut at 52%, and then shellfish, thin fish, soy at 42%, then wheat, milk, and egg. So it was very interesting to us to see that most of the foods that kids are most commonly allergic to, they have experienced a severe reaction. This next slide, we start talking about tolerance. And tolerance is interesting. We're all interested in tolerance. We want to know when our kids are going to outgrow these food allergies. And so what tolerance is, the definition is a suppression of cellular or humoral responses to the allergen. So it's basically a decrease or disappearance of symptoms over time. And there's not a ton of literature on tolerance currently, but I'll tell you what there is. And for milk allergies, the data showed that 79% had outgrown their milk allergy by age 16. Now, I'm not sure, based on our data, if this is still as accurate, because it did seem like kids were holding on to milk allergy longer. Egg was 68% by age 16. Tree nut was 10% resolution overall. So there wasn't an age. It was just overall only 10% of people with tree nut allergy actually develop a tolerance to it. And for peanut, it was 21.5% by age 17 and a half. Now, we are working on studies to determine better population-based rates for tolerance, and also tolerance for less common food allergies, because these are kind of the top 4 that were thought of for food allergies. So a lot more research needs to be done in this area, and we're working on it along with many other researchers around the country. Now, the next slide talks about future directions, so treatment options, and this is really exciting. So, there are many people and many foundations, including the Food Allergy Initiative, that are working so hard to try to find a cure for food allergy. And I think that's all of our goal. And the ways they're doing this is testing a couple different techniques. And they're listed here, and I'll go through them quickly. But oral immunotherapy, OIT, is thought to be a promising technique for kids to develop tolerance. And this is the desensitization to tolerance. So what they do is basically they start kids on a small amount, say a peanut, and they slowly increase that over time. And over time, they're able to tolerate more and more peanuts. So that seems promising, and there are, it's going on here in Chicago and around the country where we're doing trials for oral immunotherapy with children. Sublingual immunotherapy is very similar, but it's a small amount of the allergen given under the tongue. Heat denatured protein is when we bake the food and feed it to a child slowly again and do a daily ingestion to promote the desensitization. And this is commonly used for milk and egg only. And then there's a Chinese herbal medicine where herbal remedies used in Asia for centuries are thought to improve food allergies or develop tolerance for kids with food allergy. And so kids take these herbal medicines daily over time, and we're trying to see if they do indeed become tolerant to their food allergy. And like I was saying, clinical trials for many of these therapies are underway across the country. More are planned. And on this slide, if you can see it, there is a website, the Food Allergy Initiative, usa.org /clinical trials. And at that site, you will be able to see a lot of the clinical trials that are currently underway and where they are happening in case you have a child with food allergy and you're interested in enrolling. Okay, now we're going to get into the impact food allergy has on families, and I think this is very important. I personally am not only a researcher in food allergy and a physician, but I am a mother of a 5-year-old who has peanut and tree nut allergy and recently outgrew her egg allergy. So I understand the impact food allergy has on life, of the child and of the family. It's very dear to my heart. But we have also done some research in this area, and so I want to talk to you a little bit about what we found. So we had done a study looking at the impact of pediatric food allergy on caregiver quality of life. And what we found was the quality of life did vary depending on different foods and different characteristics. However, the one thing that was consistent was that caregivers were consistently troubled by social limitations. And I think this is intuitive and it really does make sense, but it's important to hear this because food is a part of everything we do. It's a part of everything kids do. It's a part of school activities, birthday parties, sporting events, social events. And so the hardest part, I think, for children and families is to be able to take their child and let them participate safely. And so this was a theme that was consistently heard throughout the study. Poor quality of life was significantly more likely if the child had been to the emergency room for food allergies in the past year, had multiple food allergies, or had a milk or wheat allergy. Most probably because these are harder to avoid and they are in so many different types of foods. Now, these are quotes. The next slide is a slide of quotes from families who did respond to the survey. And I'm going to read a couple because I think it really takes home the message of the burden on the quality of life. So emotional burden. These worries are constant. They don't ever go away and can sometimes become so overwhelming that I feel paralyzed with fear. It is a daily struggle to provide a normal life for my son while keeping him safe from the food allergens that are so dangerous for him. Someone else stated, why focus on all these negatives? Food allergies only rule your life if you allow them to. My son leads a perfectly normal life because we don't treat him like he needs to be in a bubble. For stigma normalcy, one of the quotes stated, My children are singled out. They are different. I feel badly for them. I do not wish this hurdle on anyone. For social interactions limitations, I work out of the home and homeschool our children because of food allergies. I do not feel schools are adequately trained to handle children with life-threatening allergies. Another quote, he has been at 2 birthday parties in the past week. At one, his right eye got red and swollen. He took Benadryl and was fine. The mom called me. I let him stay because I don't want to make him feel even more different. But I was at home, nervous, car keys in my hand. It made me so sad. Daily burden. Still, after 7 years, I find myself still struggling daily with meal preparation. It is tiring to have to always be on the alert for any food situations involving my child. My son experiences anxiety when eating foods out of the house and has limited his food choices as a result. I believe that his food allergies have affected his nutritional intake. And then on a positive note, a parent stated, the one positive aspect of our daughter's allergies is she, in general, eats very healthy foods. Now, this next slide, we talk about food allergy tips. And we've broken it up into a couple of groups. So this first one is household. And these tips were, we actually ended up asking multiple parents about, what would make your life easier? What tips do you have for other families? What have you learned as being a parent of a child with food allergy that would help you? And so these are some of the ones that we were given we thought were good. So for the household, plan ahead. Stock safe foods for that impromptu party. Many people said that kids would come over, there'd be an immediate play date, and you wanted to have safe foods for all of them. Talk to other families, share information on local or online resources. There are support groups throughout the country, and the Food Allergy Initiative website or the Food Allergy and Anaphylaxis website, FAN, has information on those resources and where you can go to find a support group in your area. Build a food calendar. If you plan ahead each meal for 1 week and repeat weekly, you'll be better prepared at the grocery store. And then when you learn new recipes, you can create an additional list and switch them out on your calendar. And then remember that simple can be just what kids like. If you make or buy some of your kids' favorite treats, that may be enough to keep them happy. And often kids don't need endless variety to feel satisfied and included. They like their favorites and they're happy to eat them over and over. Okay, the next set of tips are for school. So for parents of a child without food allergy. So now first I'm going to talk about the parent who has a child but they do not have a food allergy. It's important for these parents to be aware of kids with food allergy in your child's classroom. And it is so wonderful to have that support of parents who don't have food allergy, or who have children who don't have food allergies. I mean, I can tell you personally, my daughter is in a classroom and she has food allergy and she's not allowed to sit. It's not a peanut-free school, so she can only sit with kids who buy their lunch and not with any of the kids who bring their lunch. And one of her best friends, a couple of her best friends always bring their lunch, but their parents wrote me, called me, and told me that their child is not going to bring any peanut products to school because they want to sit with my daughter and want her to feel included. And that meant so much to me and to my daughter. And I think it's so important to get the support of other families and other parents and make them aware of how serious the food allergy can be and how important it is that their children also support your child. So help support the affected child by knowing what snacks they can have. Now, for parents of a child with food allergy, provide a written action plan and medications, the epinephrine autoinjector, EpiPen, Twinject, whatever brand you have, and antihistamines to your school. So explain to your teacher or your classroom how they need to be taking their medications. Have that action plan ready for them. Make it easy for them. Train them on how to use the epinephrine autoinjector. Make sure it's written somewhere where if there is a substitute teacher, they know how to access that. Initiate a 504 plan. This is a plan in the school that goes in their record that says what they should do and any additional resources that they need. Educate all the teachers that will be dealing with your child on their allergy, their reaction history, what tends to happen in case they do have a reaction, and what exactly they should do, as we talked about. And then, again, make sure everybody is trained in using the epinephrine autoinjector. Finally, for social, educate your friends, and with humor, if possible. Don't assume that other people know about food allergies, and don't be afraid to start from basics. What I can tell you, this is a little bit off, but we had done a survey of the general public around food allergies to see what they know. And a couple of the biggest misconceptions from the general public were that they actually thought that there was a cure for food allergies. And they also thought there was a medication the child could take to prevent food allergies. So they were thinking of it more like environmental allergies, like your child takes their Allegra or their Claritin or their Zyrtec and comes to school and will be safe. And so for them, educating them so that they know that that's not the way food allergies work and they can be very severe is essential. And then there's an example. You can say something like, yes, I am now the peanut police. I have to tell people to wipe their table down even though it is probably perfectly clean. So the point of that is to try to use humor and keep people informed. You can educate people and still keep the tone light and conversational. And then your child is his or her own best advocate. From early on, teach your child what he or she can and cannot eat. Test them in different situations, such as restaurants, cafeterias, and homes. Teach them to ask about ingredients. Make it a game to always play detective. And if they're not sure, give them access to a few people they can always ask who do know what foods contain. They should ask, is there peanuts in this food? Am I allowed to eat it? It's definitely very important, and we've seen this in kids with food allergy. They are their own best advocates. And this next slide, if you can see it online, is one of my favorite comics. So it is a picture of a mom talking to her son saying, when I was your age, there were no food allergies. And I'm sure we can all agree with that. When we were young, most kids brought peanut butter and jelly sandwiches to schools, and you didn't hear much about food allergies in general. But the best part of this comic is the next screen where it says someday. So now that child with food allergy has grown up, talking to his daughter and saying, when I was your age, there were food allergies. And I think this is all our goals, that in hopefully a generation, we will be able to wipe out food allergies. And it'll be something we can talk about and not have to have our children experience. And that's it. I just wanted to thank our team at Northwestern and Children's Memorial Hospital, and I wanted to thank the Food Allergy Initiative for supporting this research.
Thank you so much, Dr. Gupta. Hi, everybody. This is Sarah again from Kiwi, and that was just really such interesting information and great tips, so we really appreciate you being here. And we have some questions coming in from the audience, so we'll get to those. And everybody, just remember, you can type them in, and we'll we'll ask them of our expert here and get to as many of them as we can. So let's start with a question about testing kids. There's a listener who wants to know, what tests should I begin with to find out my daughter seems to be allergic to something, either food or maybe environment? So what tests can people have done, and when should they get started doing that?
That's a great question, and I didn't go into testing, so I'm glad someone brought that up. So if you are suspicious that your child has a food allergy, you should definitely talk to your physician, your primary care physician, and then get a referral to an allergist. The allergist will be doing a couple of different tests. First, they'll draw some blood. It's called an immunocap, and it will measure the IgE to that specific food. So initially, if your child reacts to a food, and if you're suspicious of one or two foods that the child may have eaten before the reaction, then you need to have that in the history, because you do not want to have a panel test done where you're getting tested to 10 foods. It's very, the test, the blood test that I'm talking about, the IgE to a specific food, it has a very high negative predictive value, meaning if it's negative, your child probably does not have an allergy to the food. But if it's positive, then you pretty much have a 50-50 chance of having that food allergy. So you don't want to be trialing multiple foods because you may, have high numbers and avoid foods that your child may not be allergic to. So try to really think about like what it was it that my child ate before they reacted. And when you go to the allergist, please explain that story to them so that they can test for those specific foods. So they'll do a blood test. They'll also do what's called a skin prick test, where they put small amounts of the allergen in the skin, and you see if there is a wheal. It's called, like it swells up basically, and depending on how much it swells up, kind of tells us if there's a potential that your child is allergic to that food. Now, the gold standard is called an oral food challenge, and what that is when in a controlled situation, so usually in your allergist's office, you give the child small amounts of the food that we feel that they may be allergic to, and see if they do indeed react. I mean, that is the only pure, true way of knowing if a child has a food allergy. That's also the test we do to determine if they've outgrown the food allergy. We typically bring them into the office and give them very small amounts of the food until they're able to tolerate, for example, one full egg. So I can give you my experience with my child who had an egg allergy. You bake an egg, brought in an omelet, and gave very, very small amounts over 3 to 4 hours until the full egg was gone and there was no reaction. And that pretty much told us that she had outgrown it.
That's great. Is that what's known as IgG testing? Someone asked about that particular kind of testing, and I'm not sure what that is myself. And
yeah.
what you think of it.
Right. That's a little controversial. Right now, the well-known testing, what's written in the NIAID guidelines that recently came out for diagnosis and management of food allergies, is the skin prick test, the immunocap or the IgE, and the oral food challenge. The IgG is being used and tested, yet there's no conclusive evidence that it is it's the way to go.
Okay. We have a couple questions about food allergy causes. Someone who has a 3-month-old with many food allergies, do we know why that's happening? And just 3 or 4 more people wondering if we have any thoughts that you can share.
Yeah, no, I appreciate that, because I was going to bring that up and talk about it. I knew someone would ask about it.
Yeah.
Because I think that is the number one question we always get asked, like what's going on, what's happening, genetics, environment, what's happening where, food allergy seems to be increasing so rapidly. And unfortunately, there is no conclusive answer to that. I mean, I can tell you some of the theories out there. There's a popular theory called the hygiene hypothesis, where it's theorized that we are becoming too clean in our environments, and food allergy being an immune reaction to the food. Our immune system is not reacting to normal things that it would typically react to, viruses, bacteria, and therefore it's attacking things it shouldn't be attacking. Another common theory is the way we eat our food now, the processed food that we eat. It's changed very much over the years on how we used to eat fresh, locally grown food. Now, I mean, again, these are all theories, and there's not any conclusive evidence. There was a vitamin D theory, as there's a vitamin D theory with multiple chronic diseases, but that too is not conclusive. There's a lot of people trying to figure it out. I mean, personally, I do think it's somewhat genetic, somewhat environmental, but something in our environment has had to have contributed to the rise that we're seeing. And some of our research is definitely looking into that. I mean, we are just as you are, very curious about that. And if we can get to the bottom of it, that would be wonderful. And if anyone else has any theories they want to share that we should be looking into, at the end or some way, get them to Sarah. I'd love to hear it.
It's very interesting. Such a mystery. Yeah, great that people are working on trying to figure that out, because that brings me to our next question is there any way to prevent them? Someone asked about, are there any recommendations for pregnant women to help prevent food allergies in the baby? And she says, I hear and read both don't eat nuts and do eat nuts, for instance. So is there any way that we can, keep our kids from getting them, or is that still unknown too?
Right. You know, I feel so bad repeating that we don't have conclusive evidence on much of these questions, but unfortunately we don't. Now I can tell you the American Academy of Pediatrics had a pretty strong policy on introduction of foods after a child's born and not introducing things like peanuts until the child is at least 2 years of age. Now recently there's been a lot of work on do we avoid foods in pregnancy because of fear of the child developing food allergies? I think right now, what we're saying is that if there is a strong history of food allergies, then a pregnant woman should avoid the foods that is in their history. However, if there is not a strong history, I don't think it's a strong. Physicians aren't advocating to blankly avoid. And I think this is because there is that controversy. Now they're doing testing also for early introduction of certain foods like peanuts, milk. Like if you do introduce them at a certain age after the child's born earlier than we have been, would that cause the immune system to take it in and not develop an allergic reaction to it? So we thought we were sure of what we would say when we told pregnant women to avoid and parents to avoid certain foods until their children were older. However, it's all being reanalyzed, and we're really looking into, is that the best message to send? Is there a strong relationship between avoiding a food till they're 2 or 3 and then not having that food allergy, or should we be introducing it earlier in life? So there is some great work going on right now for that, looking at early introduction and in pregnancy, what mothers eat. So hopefully what I can say is, because the research is ongoing and it's been going on for a couple of years, we will hopefully have better answers to this in the next year or two.
That's great. Yeah, hopefully we will. And, we have some other people writing in that, they're all hopeful too and supportive of, of all of this research. So that's great to hear, everybody.
I mean, I can say that I think research has definitely increased in food allergy over the past couple of years, much more than it ever was being done. And a lot of that credit goes to parents who are pushing for it, pushing the NIH, pushing the government, contributing to the research through things like the Food Allergy Initiative. We've definitely seen an increase, a strong increase all over the country in food allergy research.
That's great. What are some other ways that parents can get involved to support that? Is it something, can they check out? I know the Food Allergy Initiative website is faiusa.org.
Yes.
I want to share that with everyone. Someone did ask about that. Is that a good place for people to get started if they want to take action like that?
I think so.
Mm-hmm.
Yeah.
Great. Definitely check that out.
So, yes, that organization has been really such a strong leader in not only research, as they do fund lots of studies all over the country, including the clinical trials. I think that's their big area where they are wanting to find a cure, and they are sponsoring many of the clinical trials that are going on across the country. And they also work through policy to advocate for policies for children with food allergy. In Illinois, we just passed a policy where every school has to have an epinephrine auto-injector. Just one in every school. It's kind of part of the first aid kit, so that if any child has an anaphylactic reaction, there is one available in the school. This came off of one child in the Chicago public school system that passed away, unfortunately, because she was known to have a food allergy, however, did not have an epinephrine auto-injector in school, and they were not able to save her. But policies like this, to protect the kids and parents, standing for them and making their voices heard, I think is definitely critical, and it definitely has already shown to make change happen faster, and we'll just speed that up even more.
That's great. That sounds like such an important new policy and such, seems so obvious, but of course it's very complicated to make that happen. So it's great that was able to, get into place in schools. We have, let's see, let's step away from some of the cause and effect stuff, although we'll come back to that because I know there's some other questions about it. But someone was asking about if you know anything about using alternative medicines like Chinese herbal products or acupressure to deal with food allergies. Do you know anything about that?
I know that they are being used, and the Chinese herbal medicines are actually being tested in clinical trials, which is great. Now, I think alternative medicine is fabulous, and I think it definitely has its role alongside other, clinical treatments. However, just I would warn families to be just a little bit careful because, as with any disease where parents are, really anxious to try to find a cure, many practices pop up, promising to do this or that through unconventional means, I guess, that are not substantiated or researched. So if you do, have something that you've heard of or are interested in, I would try to do your own due diligence and seeing, asking, has any research been done? What are your show me something. Show me something showing that this works. Because currently, all of that has not been proven to help in food allergies. Now, acupuncture, I think, is an amazing tool, especially for reducing even the stress that food allergies can cause and the tension both in the child and the family. So, I mean, there are advantages of a lot of these techniques that are used in multiple situations that will not hurt the child or the family. But again, like I said, look for the literature, ask the right questions, make sure that a lot of these are paying out of pocket, and I just don't want anyone to get taken advantage of, I guess, because
Right.
they haven't been proven.
Right. So do your research and find someone you can
Yeah,
trust, and make sure it's safe, regardless of whether it's
exactly.
going to
Help.
improve, and then see if
Right.
it does. Right. That's great. Um, we have a listener who writes that I have a child with life-threatening food allergies that have been diagnosed by a pediatric allergist. It really irritates me when I hear others say that they or their kids have a food allergy because they get a tummy ache. So how do you respond to that? Do you have any advice for dealing with the people who maybe don't quite get the difference between intolerance and allergy?
Right. That's great because I hear this all the time and I experience it personally. The other thing we found in our survey of the general public is the general public overestimated food allergies by a lot. I mean, they thought 20 or 30% of the population had food allergies. But in that food allergy, they were not speaking of true food allergies. They were speaking of intolerances and other uh, diseases that may not have anything to do with food allergy, but involve food. So intolerances is one of the biggest ones because it is an enzyme deficiency, and it is not life-threatening. And yes, they get a tummy aches and bloating, but it is to milk. Like milk is the most common one, and so in food allergy can be to milk. I think it's really, really important, this education piece, which we're trying to do all over the country right now, to tell people that food allergy is different because it can be severe and life-threatening. And these are some of the symptoms my child's food allergy can cause. And if you have to explain it, explain it. This is something that's caused through the immune system and can cause my child to, have trouble breathing and drop their blood pressure. And, it can be severe because people don't think of those symptoms as allergies. And we found that in our general public survey as well. But what we also found is if you do educate them, they do understand and they are sympathetic. They don't know. So it is frustrating because people will equate it. And the other frustrating thing is some children with true food allergy don't have severe symptoms, and they have a food allergy maybe to shellfish or something that's a little bit easier to avoid and have never had a severe symptom. So go around living a relatively normal life compared to other children who have experienced severe reactions and may be allergic to things like milk and wheat, where their life is severely restricted. So as parents of children with food allergy, we all have to be on the same page, whether or not your child has, experienced a severe reaction or not, to know how important it is to educate our community on, well, my child may not have, all of that, but it's still very, very important for us that all children are protected. So, yeah, I think education is key. And not only the Food Allergy Initiative, but there's another group, the Food Allergy and Anaphylaxis Network. They have a lot of great educational materials on their website. And sometimes just, one parent had told me they just have a letter explaining it, just one piece of paper. So if parents do say it, and just say, I just want to pass this out at the beginning of the school year to all the parents so where we're coming from, and just circulate it so all the parents understand what type of food allergy your child has and what could happen if they eat the food, and how you would really appreciate it if they would help you to protect your child. And most parents, if put that way, tend to respect that. And there is a sample letter, I think, on one of the websites, on Food Allergy Initiative or on Food Allergy and Anaphylaxis Network, that you can give to the school.
That's great. And the Food Allergy and Anaphylaxis Network site is foodallergy.org, so everyone should check that one out too. So we have foodallergy.org and faiusa.org. It's great resources for this kind of help to to spread the word, and also in your own life, everyday life. Speaking of education, somebody pointed out that gluten-free is this hot topic these days, and wondered what the connection is with gluten and allergies, because I think that sort of goes along with this. There's a tolerance issue and some other dieting issues, but then there is also a real gluten allergy too, right? Can you explain to us what some of those differences are?
Yeah, yeah. So I think gluten has been implicated for a lot of things recently, and it's become very popular to have a gluten-free diet or be vegan, I believe would be the term for it. It has definitely become a popular diet. There is definitely a true IgE-mediated food allergy as well. And then there's gluten insensitivity, which is something in the gut. So yeah, I think gluten does get complicated, because gluten insensitivity is you can have it in, it's specifically in your, it is immune mediated slightly, but it involves the mucosa in your gut. So what happens is I don't want to get too technical, but the villi in your gut, flatten, and you're not able to absorb food as well. So you tend to have more GI symptoms and weight loss, and that is a true disease, but it's different from a food allergy to gluten. And then it's not part of the fad diet, which a lot of people tend to be on these days, the vegan diet, which is actually a very healthy diet. I'm not denying that. I think it's a very good way to live, and it's a very healthy way to live. However, people who may be vegan and on that diet don't necessarily have either both a gluten insensitivity or a food allergy to gluten. They're very different, yet very confusing.
Right. There are a lot of different ways to choose to eat, whether you're cutting out gluten or you're cutting out dairy and eggs if you're vegan. But, right. So for some people, it sounds like, they absolutely have to, because they have that testable allergy. And some people don't have to, but they prefer it. And so whatever you choose, it's important to figure out how to still get all your nutrients and everything. And that's the kind of thing we usually recommend in Kiwi when we're talking about those kinds of different diets. And of course, if
exactly. And the gluten insensitivity, right? The celiac. That's exactly it. So gluten sensitivity is the celiac disease, what you commonly hear, but that is very different than having a food allergy. Even though it is very important to diagnose as well, because it can cause symptoms, the weight loss, and you're not able to digest what you eat, and then GI symptoms as well that are relatively severe, but not life-threatening the way a immediate reaction to like a food allergy is.
Right. Let's see, we're running out of time here, but let's do a couple more, if you don't mind, Dr. Gupta.
Sure.
We have a couple of people who were responding to the, why food allergies might be on the rise, and people talking about the cleanness of our food today, and what we're eating that's in the environment and everything. And a couple of people wanted to know if you have any thoughts or if there's anything out there on the connection between GMOs and allergies. We did a Kiwi College a few months ago on GMOs, and someone reminded us of that, and that presenter, pointed out that there might be a link, and wondered if, from your perspective, if that's an area that's being studied or that you know about yet.
Yeah, no, I think GMOs are very interesting, and whenever you genetically modify any foods, it raises the question of, what is this doing to us, and how is this impacting our bodies if it's not, the natural food that we are supposed to be eating. And I don't know. I mean, I agree. I mean, I think they could play a role, but the degree to which they play a role in food allergies is definitely unclear. But I appreciate that, because I do agree that um, that it may possibly play a role not only in food allergies, but in other chronic diseases as well. I don't know if the presenter who spoke on GMOs made any correlation to food allergies at that time.
I think she was pointing to a connection, but I don't think there was a specific study, and that's part of what we were talking about GMOs that day, was that there isn't enough research on it. So,
no,
so this is
not.
probably part of it, that we need to learn more about how they might affect and whether food allergies are something that they affect in people's lives.
Right.
Interesting area, definitely. Yeah. Well, let me just ask you one more question about someone who asked about when you're testing for kids. I think maybe we talked about the IgE test maybe only being 50% accurate. Is that right? And what do you do then? I think I think the question we're trying to figure out here is, what if you're not exactly sure what your kids are allergic to? How do you go about living your daily life? You don't want to avoid foods if you don't have to, but you certainly don't want to give them something they might be allergic to. So, how do you live?
And that's
what do you do, and how do you live in this kind of limbo?
Yeah, well, I mean, I think that's why it's so important to really pay attention to history. For physicians to really listen to your story and when your child reacted. Should never be, if you don't know your child has a reaction, there's no strong family history, they should not be tested for foods. They should eat a normal diet. And if you do notice that they, break out in hives or have any reaction to a food, that's when you need to really pay attention to the food. But we're really advocating against blanket panel testing. So what happened a while ago is there was a lot of discussion on physicians aren't able to identify food allergies, and they're not testing for food allergies. And so they kind of flipped, the pendulum swung the other way, where now physicians were panel testing for multiple foods when a child came in saying they had a food allergy, and then parents would have to avoid those foods or wouldn't know what to do, be in that limbo. So I think the biggest thing is, don't test unless you have a strong feeling that is the food that caused the reaction. And especially don't test to anything the child has been eating in their diet regularly, unless you feel like they ate that specific food and had a reaction to it. But, if they've been eating it, you don't need to do a blanket panel test of all the common foods. If they've been, drinking milk regularly, you don't need to test for milk, because it puts you into a limbo of whether you don't know whether to avoid it or to feed it. So really try as best as you can to hone in on what could be causing the reaction, and only test for those specific foods. Now, if, like I said, 50% positive rate, but 100% negative rate. So if a child does not test, have a strong IgE number on their testing, then chances are they do not have an allergy to the food. It's just the positives that get us a little bit confused. Now, if you do have a positive for something you feel your child can tolerate, but now you're scared to give it to them, ask for a food challenge. And what they will do is what I described before. Well, they'll bring them in, and under controlled circumstances. So you've got the doctor there, you've got the medications that they would need. You feed them that food slowly. And if they're able to tolerate it in the office, you're free. You can feed them that food. But if they do react in the office, then there are physicians there, and there are epinephrine auto-injectors. They can take care of your child, and for the future that you should avoid that food. So that is the absolute gold standard. And if you want it, if you're concerned, then definitely ask for it. We really feel like those should be being done more often, because they would clear any questions out of a parent's mind.
That's great. Really helpful, useful information there. So, and we're coming to the end of our time. So, Dr. Gupta, thank you so much. I don't want to take any more of your time today. I know we got to get you back to doing more research on food allergies so that we can all have our answers in a few years.